Hey everybody, Dr. Dennis Ciccone from Ciccone Family Chiropractic here. I am here with one of my patient's moms, and she's going to share a little bit about her story with her daughter Allegra. So um, please share your story with us. What kind of brought you to our office? How did you hear about us? And then we can talk a little bit about the journey.
Okay. Well, we found you probably via Facebook ad regarding inflammation because about a year ago, my daughter, who was 13 at the time, was dealing with a lot of random joint pain, swelling of her joints, even to the point of having fluid collecting around her lung, ending us in the ER, and just a lot of strange health, unexplained behaviors going on. And we're just seeking answers, looking for somebody to help us fix what's going on and not just take a pill.
Yeah, and it was awesome. And you reached out, and you were, you and your husband were so thorough. You sent out a good story of what was going on, and we even talked about it today because your daughter right now, just so everybody knows, is doing so well, and is progressing so well. But we had talked about what that letter looked like and just how bad it was that at a year ago. And I asked you if you had read it, and you were like, no. And I was like, I bet if you did, it would bring you to tears of how much progress she's made. And your daughter has worked so hard in the program, and she's like a trooper. And trust me, I know she wouldn't be doing as good if it wasn't for you and your husband pushing her along. But she has worked really hard. She's pushed for this, and she's done the right thing. So that's the other part about the program is you have to do the work. I can't just give you the information. You guys then implemented a lot of things. So why don't you tell me a little bit about that? Why don't you share maybe what other patients want to know about, which is the difficult part. You know, it's not always easy, right, to go through something like this where you're making lifestyle changes, and your daughter, maybe it was some days were good, some days were a little more challenging.
Yep. Well, Allegra was kind of a meat and cheese kind of girl
Yep.
before we started this. And it's, as you know, it starts with a food sensitivity test
Hmm.
where we took the test, did some blood work, and found out she was triggered by a lot of different foods and a lot of foods that are healthy and a lot of foods that are gluten free, which we have been doing a lot of gluten free because that's kind of what is out there as avoid that for inflammation. And all those products that are in gluten free were also irritating her. So we started eliminating as many and all of those high trigger foods and mild trigger foods and just eating what was okay with her for quite a few months.
Yeah,
And
I
that
love
was hard for a 13-year-old.
I love that you said that like that because it required some changes for her, which were some of the obvious stuff that you guys were already doing, but also the test just people don't understand that when you look at the test, right, the shocking thing are the good things that are getting you sick, right? That you're like, oh my goodness, I was doing everything I thought was right, but it's actually not right. And then you look at the data and you start removing them and you start to see these improvements as you heal. And that's a part that always shocks me because most patients know what they should do. But when you look at the lab and it says something like avoid broccoli or avoid Brussels sprouts or something like that, you're like, that can't possibly be. And then you remove it, and all of a sudden the body starts to heal. So the testing is so important. So I'm glad you said that perspective because sometimes I don't think about that side. I just think about the difficulties of removing the foods. And, you know, I have trouble having adults do it. That's why I always tell your daughter I'm so proud of her because she's a trooper. So
Yes.
anyways, anything else you would share to maybe a mom that's watching this that maybe is struggling themselves or has a child that's struggling about the program? Is it worth it? Is it worth the challenges? What would you speak to them and just say, hey, there's hope out there?
Well, it's been less than a year, as I was mentioning on our call, that we've been with you guys, and her improvement is so dramatic, and she's able to function and play sports and be a normal teenager right now. And it's not a cheap option to do it this way, but it was definitely an option that was worth doing for us. And um, yeah, I will get emotional if we talk about it more because um, things have really changed for her and for us. And she's worked really hard, and it not the whole family has to join in, but definitely it's worth making the effort, because when you're trying to do it on your own, there's so much mixed information that you find on the internet, and it is really overwhelming. So it was nice to have a team supporting you and telling you this is how we're going to do it. So
And it's awesome. And even though there was an investment into it, right? Because obviously there's our time and your time and all that expertise that goes into it. Um, you would certainly do it again. You feel like the investment was worthwhile for all the improvements that you had.
yes, we
Yeah.
would.
And I've loved working with you and your family, just so you know. So it's been a complete pleasure. So thank you for sharing your story, and look forward to working and continuing to work together with you guys. So have a
Thank
wonderful day.
you.